Physical Medicine Working Group webinar. We're going to be talking today about the subject of becoming a parent as a childhood oncology rehabilitation or physical medicine professional. Now, that's something that is not often talked about. So that is why we are having the conversation today. We've got four colleagues from across the world. They'll introduce themselves to you, but we've got Rachael Keating, Precious Madzimbe, Amanda Wurz, and Alicia Souveny. And we've got people from different regions. So we've got colleagues here from Canada, from Zimbabwe, from Ireland. We've got physiotherapists, we've got researchers, and we've got people at different parts of their parent journey. We've got three parents, two mothers, one father, and really interestingly, we've got a colleague who is about to become a parent. So I'm going to introduce to you first, Rachael, but before I get started, I should say this meeting is being recorded. We would ask participants to keep your cameras off, please, and keep your microphones muted. It will be available on the SIOP YouTube channel. So on the channel, you will see the presenter, which is me, Abu Sidani, and the participants talking. And then at the end, we should have times for questions. And if you've got any questions or you would like to at the time, you'd be very welcome to turn your cameras on then. If you have any questions as we go along, please pop them in the chat and one of our team will get back to you. So we'll get started. And our first guest today is Rachael Keating. So Rachael. Rachael,
Hello.
can you hear me? Hi.
Yes, I can hear you. Thanks so much for having me.
Um, Thank you so much for joining. How are you doing?
I'm good, thank you. Yeah. The weather is slowly changing here in Dublin. The evenings are getting shorter. But yeah, all good.
Yeah, so this is part of our summer series, but I think you're right. By the time we get to the end of this series, we will be probably approaching a different season in most
Yeah,
places. So this is
definitely.
the second of our three series. So Rachael, as you mentioned, you're from Ireland, so please tell everybody where about you live, and could you tell us something interesting about where you live?
So I am living in Dublin in Ireland, which is the capital. For those who may not know where that is, so it's Ireland is a very small island just off the coast of the UK, and Dublin is on the east coast of Ireland. And it's not terribly interesting, but it's possibly the most widely known thing that people would know about Ireland is that Dublin is the home of Guinness, the beer. So we have a huge Guinness factory and tourist experience here, which I think is actually our most popular tourist experience in Ireland. And there's like millions of people who come through it every year. So that's probably our most international export, I would imagine.
Thank you so much. And you mentioned that you live in Dublin. Tell us about where you work and how long you've worked in paediatric oncology rehab.
Yeah, so we have two pediatric hospitals in Ireland, and both of them are actually based in Dublin. I work in Children's Health Ireland at Crumlin, and that's where our National Children's Cancer Service is based out of. So I've been working in the cancer service for the last just about 7 years now, actually, this month. So yeah, a good chunk of time in the one service.
Wow, yep. Okay, so now let's talk children. So I've been lucky enough to meet your daughter when
Yeah.
she was tiny. So can you tell us a little bit more about her and how long you've been a parent?
Yeah, so Sive is my little girl. Sive is a very Irish name. She's actually turning 2 next month. So she was born in September 2023. I was very fortunate to have a full year off for my maternity leave. So I went back to work in September 2024. So yeah, next month I will be back in work for my 1 year anniversary after returning. So yeah, I feel like it's flown the last year. I can't believe how quickly it's gone by and how I have a raging toddler on my hands now.
1 year has gone very quickly, I'm sure, for you.
Yeah.
So I'm going to ask you now to just think back a little bit before you became a parent and before you returned to work. And we're going to talk about practical things a little bit later.
Mhm.
But the big question is, did you notice a difference in your approach or your mindset when you became a parent?
Um, Definitely, I think before becoming a parent, like while I was pregnant at work and before going on maternity leave, I definitely didn't see any changes before going off. And I don't think it was on my mind that things would be different when I came back. I don't think I was expecting any major changes. I was a little bit anxious and apprehensive about going off work and kind of taking that time off work because I'd never had such an extended period of time off. And as I previously mentioned, I suppose maternity leave is quite good in Ireland. I was very, very fortunate to have a full year off. And so when I did go back, I really struggled for the first few months. It was like seeing work in this wholly different light and seeing the service with complete new eyes. I think because I had gone from spending every single day for an entire year with Sive to then all of a sudden going back to work after that year of having such a close relationship and bond with her, I found it really hard to focus and work for the first while because it's the very first time that I had spent prolonged periods of time away from her. And so I remember the first like 3, possibly even 4 months, all I could think of was her. And I wonder what she's doing today. And I wonder, is she okay? Is she thinking about me? And I just couldn't kind of come out of that fog for ages in work and really kind of focus on the job at hand, which is very different for me. I was always kind of so switched on, so focused, so goal orientated, as most of us are as rehab professionals. And yeah, it just took me an awful lot of time to adjust to being back in work and settling back into that routine. Um, and then it was the other things that I kind of noticed that were different was I previously would have really loved working with the early years, particularly the under twos in work. I used to always pick up the neuro-oncology referrals, the kind of the neurodevelopmental referrals. And I could not go near those when I went back. I just couldn't do it. Um, I think from the emotional kind of side of things, it was just all too much. And I just couldn't let myself go there that under twos can be sick. So that was quite a change in my practice as well. I found myself gravitating seeing the adolescents and the teenagers an awful lot more, which yeah was very uncharacteristic for me or for previous me, I suppose. And I know we'll probably touch on emotional boundaries a little bit more, so I won't go into that a huge amount right now. But yeah, they were probably the main issues was actually just trying to focus and turn my brain back on for those first kind of couple of months. It's possibly not still fully turned back on just yet, but it's definitely getting there.
Yeah, I'm not sure it ever does, but
Yeah,
yeah, we live in hope.
it's definitely better.
So yes, emotional boundaries. So you mentioned that, and they are something that can be challenging for anybody working in childhood cancer, even at the best of times, let alone after becoming a parent or being pregnant. Could you tell us a little bit more about that and how they might have fluctuated for you? If you've got any examples, that would be great to understand.
Yeah, absolutely. I suppose again, like pre-baby me was very boundaried. I never struggled with that aspect. I was very good at kind of distancing myself and not getting kind of drawn into the emotional aspects of all the cases. I just kind of went in, um, did my job and left and never took it home with me. And it was never something that I found difficult. Whereas going back to work, it was, yeah, oh my God, I had no boundaries anymore. Like those walls had just come crumbling down. I found myself doing all these really unhealthy things that I never would have done before, like putting myself into other parents' shoes, seeing a parent on the ward with a 2-year-old and kind of thinking, oh my gosh, that could be me. Imagine if that was me here, what would I be like? What would I be like as a parent on this ward? And going down these rabbit holes and finding it really hard to get myself back out of them. And yeah, I was not kind of stopping and trying to prioritize myself in those moments. And they were all things that I never had struggles with before. And again, it really took quite a few months to actually kind of settle back into that and to be able to just kind of park the emotional side of things and appreciate that, yes, lots of incredibly upsetting and sad things happen in oncology, but as rehab professionals, we often get to see the nice side of things and the positive side of things. And it took me a while to kind of tap back into that. But gradually over time, that definitely improved. And now I kind of feel like I have it under control again. But there's definitely still scenarios that crop up. I find if I'm going down on the ward to do a planned session and I know what I'm going into, that's no problem. Like I'm absolutely fine with that. But it's the unplanned scenarios that crop up during the day that you kind of can't predict. I think I mentioned to you that hearing a baby cry now is totally different when you've had your own child. A baby's cry just like pierces through me now. And so if I'm walking down the ward, and of course there's babies crying in hospital, like there's babies crying all the time. But walking down the corridor and hearing a baby cry still almost kind of stops me in my tracks. And kind of pierces through me and kind of takes me a moment to gather myself and then walk on again. Whereas a baby crying before would have never affected me. It's not that I didn't hear it, but it just kind of washed over me. And then other little things like if you're walking down the ward and you see a parent carrying a really sick child up to theatre, and again, that's something you can't plan for. It's going to happen all the time, but it's just those kind of stark reminders every so often that you kind of run into, that definitely do just kind of stop me in my tracks a little bit that wouldn't have affected me before. So yeah, definitely, it's taken a lot of work to kind of develop those boundaries again. But yeah, I think over time it has slowly kind of settled down.
Thank you so much. And yeah, we have talked, and you've mentioned that this sort of focus on the parents' role and their well-being and the empathy that you have, it's changed in a way. So do you consider that a positive thing? And what sparked that change?
Yeah, definitely. I suppose initially, yes, I was doing that really awful thing of putting myself into parents' shoes, but what I've kind of moved on to now is actually to see it more in a positive light. Whereas I'm not putting myself in their shoes, but I definitely have a much better appreciation and understanding of what it's like to be a parent. And I feel, I suppose, much more confident in being able to relate to parents now because, I have a child. I have some idea of what it must feel like. And I think I'm much better now at focusing on parents a little bit more and reading what it is that they need in that particular moment that you're spending with them and their child, and kind of picking up on those kind of more subtle cues that I wouldn't have been aware of in the past. And I'm definitely checking in an awful lot more with parents, whereas previously I would have gone in and just kind of focused solely on the child, doing my session, obviously chatting to parents to kind of get background and everything. But now I find myself kind of checking in, simple things like, have you eaten today? Have you had a drink? Do you need a cup of tea or a cup of coffee? Just those really basic human things. But yeah, I feel myself, I have a lot more empathy and feel myself kind of just checking in and focusing on parents an awful lot more now. And that's
Yeah.
definitely positive.
Yeah, it's great. You don't feel like such an imposter, do you? Because
No,
I'm actually a parent now, so yeah,
yeah,
I can relate to you and not just tell
exactly.
you.
That's it, exactly. You've hit the nail on the head.
Yeah. Thank you so much. So on to practical things now, and we're just going to mention this very briefly because it's something that we could talk about all day long. But just
Yeah.
what is the biggest practical difference that you have noticed or has been a challenge for you?
I think I now actually appreciate the understanding or the phrase not enough hours in the day. I think I now get that. Yeah, I have a newfound appreciation for people who can manage their time. Previously, yes, I would have done my work and gotten it done, but I often would have had like extra bits and pieces and projects going on in the background when I got home. Whereas I don't have that time anymore. I get home and it's like work is finished. I'm no longer a physio. I'm a mum now. So trying to kind of prioritize and get as much done in the day between kind of 8:30 and 4:30. Because when I do get home, yeah, I don't have that free time anymore, and I'm sure loads of people can relate to that. So that's probably the one kind of biggest practical change, really, is that you just have to be so efficient with your work day and then switch off.
Thank you so much. Yeah, couldn't agree more. Not enough hours ever.
No,
Thank you, Rachel. Thank you so much. It's been absolutely lovely listening to your experience of becoming a parent and hearing all those insights. So thank you. One final thing. You're part of the local organising committee, which is in Dublin, for the ICPTO Congress next year. That's a physio Congress. Could you tell us, since you're part of the organising committee, how's the programme looking?
it's looking great. So ICPTO is the International Congress for Physiotherapy in Oncology. So yeah, it's coming to Dublin next April. It's a 2-day event, and on the second day, we've actually been very fortunate to have two pediatric specific symposiums accepted. So there's going to be a symposium looking at the role of physio in ALL, and we're also going to have a symposium on cerebellar mutism syndrome. And also, Lynn Tanner, who is logged in here, is giving a keynote on pediatric rehabilitation as well. So we're really hoping to have great peds representation at that congress, and hopefully we'll get to see a few of you there.
That is wonderful. Thank you so much. All the best, and thank you again for joining us today.
Thanks so much, Abu.
Thanks, Rachel. Right, so we'll move on to our second guest today, who is Precious Madzimbe, who's joining us from Zimbabwe. I think Precious might be having some connection issues. I can't see Precious. He had joined the webinar, but I can't see him now. Precious, just checking, are you here? No, I think Precious isn't here. So what I'm going to do, I'm going to ask Amanda if we could go next, if that's okay with you, and that'll give Precious a little bit more time to hopefully
He's
reconnect.
he's in now.
Ah, he's in. Let's see. Precious, are you able to hear?
Oh, yes, I can hear now. I had some network issues, so I'd been kicked out, but I'm back in now.
No problem at all. Lovely to have you back again,
All
Precious.
right, all right,
Um,
that's fine.
Precious, we're ready to start. If you are able to turn your camera on, that would be great. But if it's easier because of the connection to keep it off, that's no problem at all. Whatever works with you.
Okay, let me see with my camera on. If it's off, I will be happy to turn it off midway.
Yeah, fine. Now we can see you. That's great. And if there's any connection problems, just feel free to turn the camera off. Um,
Oh,
so thanks for joining. Thanks for joining again. How are you?
okay, I'm fine.
And so I mentioned that you are from Zimbabwe, and in our first summer series session, we did a few geography lessons. So for
Oh,
everybody whose geography isn't good, could you tell us
oh,
where in Africa Zimbabwe is, and where, Zimbabwe, yeah, where it is, and whereabout do you live in Zimbabwe?
oh, yes, in Bulawayo. Bulawayo is the second largest city in Zimbabwe. That's the southern part of Zimbabwe. Yes, that's where I stayed. That's all my workplace as well.
Wonderful. And whereabout in Africa is Zimbabwe?
Zimbabwe is Southern Africa. It's between South Africa and Zambia. In between, that's Zimbabwe.
So
Yes.
almost as south as you can get.
Oh, yes, yes. It's quite famous for the Victoria Falls. Yeah, that's our border. Yeah.
Yeah, yeah.
Yes.
Thank you so much. So Precious, can you tell us how long you've been a parent for and how many children do you have?
Oh, yes. Good question. I've been a parent for 9 years now. I have three kids. My oldest is 9-year-old daughter. Then the second one is a 6-year-old son. And the youngest one is a 3-year-old daughter. So I have two beautiful daughters and one handsome son.
So you're definitely a very busy guy.
Yes.
And it's obviously it's many years ago since you had your first child, but can you recall, did having children change your approach or your mindset to working in childhood cancer rehabilitation?
Definitely it did. Yes.
And just could you give us some like examples of how things have changed for you, how things were before, and how having children changed that?
Okay. Being a father helped me to be empathetic, especially with other fathers, because I could be able to fit into their shoes, understanding how parenting is. But sometimes we've been taking fathers for granted as they come, probably accompanying their kids. I normally attend to kids with the developmental disabilities, mainly from congenital issues as well as cancer as well. I've observed some neurodevelopmental issues as well in pediatric oncology patients. So as a father now, that actually changed the way I view. Because as a father, also when my kids have some issues, B2C to the pediatrician, I also accompany the mother and the child as well. I noticed that fathers usually are sort of excluded in many cases, especially some follow up, even some reminders. Usually, they sometimes come through the mother, and yet the father, I will be there. Sometimes, some workshops regarding the child. Sometimes, most invitations are directed to the mother. Then, I, as the father, get excluded. So I also try to translate that into my own practice now. But how do we view fathers? Is it fair the way we treat them? So I ended up engaged mainly with Days of Hope, which is one of the organizations here in Zimbabwe, which is trying to encourage participation of fathers in attending clinics, offering moral support to the mother, also at the same time participating in prescribed home programs, the rehabilitation home programs. So that approach also stimulated me to change my focus or to change my approach in the way I should include fathers. Now I make sure that whenever a mother comes, the next letter that I will write is to invite the dad as well. Should come along. We explain to them the condition of the child as well. We counsel them. We also teach them some basic home programs to help the mother also. Because I've been reading around, much of the research is indicating that if fathers are involved, it sort of lessen the burden from the mother as they also take up some caring roles of the child. It's also sometimes taking the child for clinic appointments, which are really good for the mental health of the mother as well. It also changed being a father, my focus research wise. I also tried through observing why fathers are not attending or they're attending in low numbers in my clinics, in my neurodevelopmental clinics. So I thought, let me try to research more and hear the views of fathers. What are the barriers? What are the facilitators to their attendance? What can be done to improve their participation? So being a father changed myself as a clinician and also as a researcher. As a clinician, it changed my approach so that my clinical care model are now becoming more inclusive, including both the fathers and the mothers. Then research-wise, also changed my focus so that I now focus more on research on fathers, including fathers in research so that to understand their concerns, also include them in the management model that we are trying to develop, which are evidence-based here in Bulawayo, Zimbabwe. Thank you.
Thank you. Thank you so much. So one of the reasons we invited Precious here is he is very much an expert on fathers. So apart from being a father himself, he's recently published an article, and he is currently researching into that area. So he brings not only his personal experience, but you bring that professional background as well to our group. So thank you. And as a dad and as somebody who's done research into this area about fathers, specifically about fathers, and you highlighted that really well in many places, in certain cultures, fathers can be excluded. People might not see it that way, but we need to bring fathers into that environment. And sometimes fathers and men need encouragement to be able to do that. And you certainly are doing that through the initiatives. But what would be your advice to colleagues? So, again, we have that focus on the child and family, but with colleagues who work with families, what would be your advice specifically about fathers? How do we engage fathers? What are the things that you advise that we need to do?
All right. We need a paradigm shift to break the barriers that fathers are usually financial supporters of whatever clinical care that the child is involved in. But we need to change that cultural mindset that fathers also can actually be actively involved, the actual hands-on, be it taking the child to the clinic, be it participating in home programs. Also, we encourage that they should be engaged right from the onset. Not that they are the financial supporters, but they are actually the hands-on. But the world has since changed now. Both the father and the mother might be going to work. So who then takes the child to the hospital? It's mainly probably the mother. So the mother is now burdened, taking care of the child at the same time working. And where is the dad? The dad is not actually included. And we've been advocating for paternity leave as well, so that the father as well has time to take the child to hospital, have the time as well to take care of the child. It's also very important bonding wise, where the son also bonds with the father. If the son has some challenges, find it easier to discuss those issues with the father. But now, if the father doesn't have any paternity leave to bond with the son, it's a mess now. When the son has challenges, still have to confide with the mother, which might not be appropriate at a certain age. So we just also want the father also to participate equally like how the mother does. So we encourage rehabilitation professionals to come up with inclusive care models, which are inclusive of both the father, the son, and even siblings in the management of children with the various conditions, developmental
Thank you.
delay, or those with pediatric oncology conditions. Thank you.
Thanks, Precious. So you mentioned, so you are a father of three children, you are a clinician, and you are also a researcher at the same time. So the definition of a very busy person. So practically, could you tell us what was the biggest challenge for you becoming a father and continuing to work as a clinician?
Good. Yes, the major challenge that we normally face are the work demands. Like I said, in our African context, in our Zimbabwean context, there is no paternity leave. So if I've got a child, a newborn with condition, I find it difficult to get an off day from work. Well, the first question they will ask is, where is the mother? Can't the mother take the child to hospital? Then I say, I'm also the father. I also need to be there. Because when the child's condition is discussed, I also need to understand the condition of my child. I also have emotions. I also need the counseling. So I need also to participate. So it's quite a challenge. Even the invitation letters which clinicians send, they are normally addressed to the mother, not to the father. So I can't use that invitation letter to ask for leave days from my workplace, which is a major challenge. So indeed, fathers are excluded to a large extent, which is actually a barrier to their participation, which we are trying to break. We are trying to come up with an evidence base. Why is this happening? So that we're able to justify to policymakers using evidence from the research that we are currently doing.
Precious, thank you so much, and all the best with your continued advocacy in this area. It's been fascinating hearing your experience and your insight. Thank you so much. Before I let you go, one final thing. You have had a conference poster accepted at the SIOP Congress. Massive congratulations. Could you just tell us the title so we can keep an eye out for it?
Thank you. Yes, we'll be in this coming month, October. We'll be in Amsterdam, the Netherlands, presenting my poster. It's a scoping review where we were trying to map rehabilitation approaches to oncology cases globally. We've realized that this oncology rehabilitation, especially in developing countries, is not well recognized. There are less like refresher courses on what approaches to use for certain conditions. So we're trying to map globally so that we have evidence at hand to what is happening in Africa, what is happening in Europe, what is happening in other continents. That is what it's all about.
Thank you so much. Precious, thank you. Really appreciate you joining us. Thanks again.
Thank you so much. Thanks.
Thank you. So next up, I'd like to invite Amanda to join us.
Hello.
Hi, Amanda. Thank you for joining. How are you doing?
Good. I'm really excited to be here. Thanks for having me.
Oh, grateful to have you here too. Amanda, you are from Canada. So can you please tell everybody where in Canada you are from, and could you describe whereabout it is and what is the weather like there currently?
So I'm from the Fraser Valley, a place called Sardis. It's in the province of British Columbia, so the west side of Canada. If anyone's familiar with Canada, it's about a 1.5 hour drive from Vancouver, so the far west coast. And we have had a gorgeous summer. So right now the weather's beautiful and hot. It's almost 29 degrees, and it's only 9 in the morning or almost 10 in the morning. So it's going to be another beautiful day, and luckily we have lots of lakes around us to keep us cool.
It sounds very lovely. Thank you. So Amanda, you're a researcher and you're very much part of our paediatric cancer rehabilitation community. Could you tell everybody how long you've worked in the area and what your research involves?
Yes, yeah. So I guess I'll clarify. I don't hold a clinical position. I lead physical activity and yoga programming for this population, and I've been a researcher in the field as a trainee and now as an assistant professor since 2014. So just over 11 years. And my area of research is very much focused on co-designing and testing physical activity interventions for pediatric and also young adult cancer patients and survivors. And most recently, I've started a secondary stream of research, which is focused on researching and testing different patient engagement strategies to better center the patient voice in our research.
Thank you. Now, your child is still quite young and you haven't been back at work too long. Just tell us a little bit about your child.
Yeah, so she is just over 1.5 years old, and I had fortunate here as well to have great parental leave options. So I had a full year off, and so I've now been back for about 6 months. And she is an amazing wild toddler, and we are just entering like a mega emotion phase, which is really fun to navigate, and it's exciting because it's incredible to see her building this autonomy. But it's also adding some new challenges to our days.
Yeah, and it's only 6 months, but it's a bit of a difficult question. But would you say things are as expected for you, harder than expected, or better than expected?
Oh, much harder than expected. for me personally to return to work. I think similar to Rachael, I didn't really, I just kind of thought like I do this work, I enjoy it, I love it, I'll have this baby, get a full year with her, and then I'll just go back and everything will be just like it was. So I found it, and I'm still kind of finding it a little bit hard. I still feel like my feet aren't fully under me. And I think it's because of a lot of things like, inconsistent sleep, illnesses that come with being a toddler. We all have a cold in the house right now. But I think what I'm most or what I wasn't expecting that I'm still kind of working through is redefining who I am in my work, but also how I work. Um, at least in my experience, I find that research doesn't always adhere to, the usual 9 to 5 day, especially at certain times of the year where I was sharing earlier, like the start of the term, but it's also major grant season. And at least out here, all of our physio and occupational therapy students are starting to apply. So we're getting all of these letters asking for support, who've taken part in research. And so it doesn't always fit in that, 9 to 5 day. And so I'm still struggling to reimagine how I work and who I am as like a parent and in my home and how I achieve all I want to achieve in both of those realms. So I wish I could say it was easier, but it's definitely been a bit tougher and trickier than I thought it would be.
Yeah, sorry to hear, and I'm sure over time we'll hope that does improve. And it's really interesting. You really jumped at the chance to participate in this webinar, and we're very grateful for that. And becoming a parent while being a pediatric oncology, rehabilitation, or physical medicine professional is not really something that is widely talked about. I mean, I don't think many of us have come across it before. So we're really interested to know, why were you so keen to participate?
I was so keen. I was so excited when I saw the topic of this webinar and this opportunity. I think it's partly because I've kind of felt a strange sense of isolation in this phase of parenthood, but also partly because I really have noticed a definite shift in how I approach my work. Particularly, I'd say in how I relate to the families and children I work with. I find that there's almost a deeper emotional resonance. And I similar to Rachael, I found myself, especially early on, imagining things like very viscerally, what it would be like to be a parent in their situation. And I'd say that this has dissipated a little bit now that I'm, further into getting my feet under me in research. But I would say something I've noticed that's carried through since coming back is I feel like it's changed how I'm prioritizing certain research questions and approaches, mainly in terms of minimizing burden on parents and families. So I'd say one of the, I guess, silver linings or one of the things that I feel has really come out of this for me is a more like nuanced sensitivity. So I've moved away from kind of that visceral emotional reactivity or response to now I would say be just, I think, able or having a different capacity to be more attuned with the patients and their parents when I'm speaking with them, particularly like in research contexts.
Very interesting. So almost that you have that lived experience yourself, so you understand.
Yeah, that part of like understanding the parent role.
Yeah.
And I don't have, the lived experience of having a child with a serious illness, but I feel like in some ways I can understand aspects of what they're going through so much more differently than when I was, a keen grad student doing research and had never experienced some of those pulls or even the feeling that it is to be a parent. I can kind of imagine in ways or differently than I could before. I think I have a different capacity there to attune.
Thank you. And one very interesting thing you've mentioned there is isolation. Could you tell us a little bit more about that? Because that might be something that many people do not realize that new parents could go through.
Yeah, I'd say the sense of isolation throughout kind of my whole parenthood journey kind of caught me off guard. I think I'm pretty socially connected, and so I just wasn't expecting, and I have lots of friends who have children in similar stages and ages as me, so I wasn't expecting it. And I think because I've had a lot of time to reflect, and we chatted a bit before this, and it spurred some reflection in me. And I think the sense of isolation is maybe more so about a bit of a disconnect from the world that I was once really embedded in, like professionally, socially, and intellectually. And I think all the parents can agree. I'm finding there's a rhythm to parenthood that doesn't always match the pace of the research or professional world that I once solely inhabited. And there's also a piece around my priorities, which have shifted and are still shifting. And that redefining and reimagining piece, I think that I kind of shared about earlier, which is kind of getting me very much, I guess, in my head. And what's interesting to me is as I reflect on this, even now and as I'm speaking, is that so many of my amazing colleagues and mentors are parents. So I'm just finding it interesting and unexpected again that this emotion has failed, and that when things feel tough, I automatically imagine, kind of feel like it's only me who this is happening to, where I know that it's not. So it's been an interesting emotion that I'm kind of grappling with as I move through.
Yeah, we can promise you that it is definitely not just you. Thank you so much. So yeah, we just wanted to touch on practical things. So just briefly, because we could talk about this all day, I'm sure, but what would you say is the biggest practical challenge or difference for you at the moment?
Illnesses. It just feels like somebody's always sick in our house. And I just find like parenting and working and just being a good human, it just feels harder when you're not feeling well.
Yeah, no, definitely.
Yeah.
No, thank you. Yeah, you just some things you're gonna have to live with bugs and flus and viruses for a while until hopefully there's enough immunity.
Yeah, and it's already slowing down, but it just I also maybe wasn't expecting that quite the way we've been hit.
Thank you so much. Thank you. It's been lovely hearing your experience and your thoughts. So thank you so much for joining us. And
thank you.
One final thing before you go, you're not attending the SIOP Congress this year, but your work is being presented. So do you mind just telling us a little bit about that? So again, we can keep an eye on it and hopefully some of us can attend.
Yes, so I can't make it this year, unfortunately, but my amazing colleague and friend, Dr. Sarah Grimshaw, will be presenting and attending, and she'll be sharing some of the work we've done together this past year during a poster session. And she'll be presenting the results from a meta-synthesis of qualitative research exploring pediatric cancer patients and survivors' experiences with physical activity. So be sure to keep an eye out and make sure you pop by and say hi to her.
We definitely will. Thank you so much, Amanda. All the best, and thank you so much. Thank you, Amanda. Next, and our final guest today is Alicia. So, Alicia.
Hello.
Thank you for joining us today. How are you doing?
I'm doing well, thanks. How are you?
Yeah, good, thank you. Now, you are also joining us from Canada. So, could you tell us where in Canada you live, and do you have an interesting fact about where you live?
I'm in Edmonton, Alberta, so the next province over from British Columbia, still Western. I tried to find an interesting fact about Edmonton. We have over 50 festivals every year, so we're known as Festival City, apparently. So
it's a very festive place. Thank you. Now, I'm going to get to the most interesting thing first. So, you are joining us because you are going to become a parent. So, huge congratulations to you. How is your pregnancy going, and when are you due?
it's going well now. Beginning was rough. I'm due on Halloween, so October 31st.
Brilliant. Halloween themed. And could you briefly tell us what current role you're in at the moment?
So I work at the Stollery Children's Hospital. Currently, I'm a float physio, so I kind of cover whatever unit is needed, whether it's because people are too busy, the unit's too busy, or people are away sick or on vacation. But prior to that, I spent a few years specifically on the oncology unit, and I still love when I get to cover over in oncology. So
amazing. And being pregnant can change many things, including emotions. So I am told. I obviously don't have experience of that. But have you noticed any of that? Have you noticed any change in your approach or your mindset since you've become pregnant?
I don't think I've noticed much change since becoming pregnant. Emotionally, things have been pretty stable, so that's good. And I would say the only impacts I'm seeing at this point are physical impacts of it's getting harder to move or to lift patients or things like
Yeah.
that. But otherwise, seems pretty standard, feels pretty
Yeah.
standard for me.
Good to hear. And again, it would be just interesting to get your viewpoint because you're at the other side of the journey to our three other participants, but you'll go off on leave and have that time away from work, and then you will return to work. And is there anything that you anticipate could be difficult going forward? Have you been able to think that far ahead? And you might not have.
I have thought about it a bit, but I've definitely maybe changed my opinion a bit more after listening to some of the other people talk today. Um, I mean, anything you have that helps you relate to patients or family can be huge in building that relationship with them and empathizing with them. So I did expect there would be some change around being a parent, relating to parents who are going through these things. Uh, but otherwise, I didn't think my treatment would change very much. But it's very interesting to hear, especially like Rachel talking about her not being able to work with kids under 2 when she came back, and Amanda also mentioning the emotional toll uh, when she first returned. And so, yes, now I'm thinking there will probably be more more to expect when I get back emotionally, but I don't think I still don't think it will change my
Yeah.
approach too much.
Yeah, brilliant. And thank you. I was going to ask if anything particularly resonated with you, and you mentioned a few things there. So, are there any tips that you think you might take away from this or reminders for kind of moving forward?
Well, I think I'll try to be more aware of the fact that when I come back, it probably will be a little bit tougher, both to refocus, but also to kind of see those, especially younger patients experiencing these things now that I have a younger one at home.
Yeah.
And I think just going in, kind of being aware of that is probably helpful. I don't think I can stop it from happening. If that's how you feel, that's just how you feel, but it's good to kind of be prepared for those emotions.
Yeah, because I think at least a couple of our participants mentioned being surprised by
Mhm.
some of the kind of changes. So hopefully there's a bit of a heads up for you there. Um, and we're doing this session because the topic isn't really widely talked about. I don't think many of us kind of come across it. And is it something that you've come across with colleagues or through your work? And I mean, do you think this is potentially something helpful to talk to parents, whether they are fathers or mothers, about in terms of how potentially um, your approach or your mindset could change?
Yeah. Well, with the entire rehab team, so that covers all the different units at the Stollery here, I know there's been some that talked about it was tougher after they had a child to see some of the kids. And I even know some people have left the job after having kids because they found it too hard. But then there's also others that have said they didn't really think it changed anything. So, yeah, I guess it's been talked about a bit, but not very in depth, and not specifically around oncology for me. Um, so, yeah, it's mentioned, but it's not really dug into, I would say.
Yeah, no, it sounds like that, but so interesting that you mentioned that some people maybe it doesn't affect them at all, while others potentially leave their role. So it sounds like, a really polarized, potentially
Mhm.
difference between those two, and some people might benefit from having conversations around that. Thank you so much, Alicia, for sharing your thoughts. It's been really interesting having you as part of this panel because you're very different and you're at the different end. We wish you all the best. Enjoy every moment. It goes quickly, so absolutely enjoy every moment. And there's so many people here that will be wishing you all the best. Thank you again. And just one final question for you before you go. Have you started buying any baby clothes yet?
You know what? I haven't bought a single item because I have so many amazing friends and I have a closet full of baby clothes already. So I don't think I'll need to buy any.
Brilliant, good. That will save you so much money, and I'm sure there's so many other things you could put that to good use for.
Yeah,
Alicia, thank you again. Thanks so much.
thank you.
I would like to just invite all the panelists, if you're still available, to turn your cameras on. We officially have 2 more minutes left of this webinar, so that is time probably for one question, and then I will allow anybody that needs to leave to go after that time. Has anybody got? Firstly, thank you to our 4 wonderful panelists for sharing your experience and your thoughts. We're very grateful to have you join us. Any questions for our panelists? I'm just having a quick look, and
Mine is just a comment. It was a wonderful opportunity to learn from experiences of other parents, mothers from all over the world. It was a good opportunity. Thank you.
Thank you very much, Precious, and we're very grateful for you joining. There's a hand up, Elizabeth.
Hi, Lizzie Rowan. I'm an occupational therapist in
Lizzie,
Newcastle.
hi.
Thank you to all the speakers. That was just really, really fascinating. And it just makes me think about what do we need to do to help support new parents back into work. I think as a female, it was really, really interesting to hear Precious speak to about how we might want to change our practice with fathers. But how do we help parents come back to work and consider their support and emotional needs?
Thank you for the question. Anybody from the panelists want to answer that?
One thing I just wanted to say really quick, I've just started studying and practicing myself a lot more around self-compassion. So I really love that question. And I'm applying self-compassion with parents of kids with cancer and in my young adult cancer populations. But I'm realizing now how valuable it is for me. So I've started adopting some of these practices. And as soon as you asked that, it made me think, oh, what a brilliant offering that could be, because it's so brief, it's short, like we don't have time to add extra things, but I think there could possibly be something around the self-compassion space and recognizing that we aren't alone, speaking kindly to ourselves around our changed capacity, and then like just practicing some mindfulness, like paying attention to have you eaten, have you drank, those pieces that I think Rachael mentioned. That was just my first thought. And as soon as you asked that question, that it cropped up because it's something I've been thinking a lot about recently.
It's very interesting. I did wonder if we did this session, if we'd actually ask more questions and have answers for. So I wonder if there is a bit of work that we take forward. We didn't really have time to talk about it, but I think if you speak to a lot of rehab professionals, you will get a theme that we are unique in our role. We are different to other professionals in the way that we, for example, have exposure to families and how we work closely with families. So it puts us at different, it exposes us differently to other professionals. So there probably is a little bit of work there, thinking about how our experience as rehab professionals is different, but also, as you mentioned, Lizzie, about how then do we support our colleagues and professionals coming back into that area. Anybody else want to offer an opinion?
I can jump in there. Just to say, one thing that I think really helped me with stepping back was, fortunately, I'm not the only physio on my team, and so I have 2 other wonderful colleagues that I work with, and so they were really good at recognizing that I was obviously changed coming back, and gave me plenty of time to settle back in. But one really practical thing that helped, I know I mentioned earlier that I really struggled with seeing the younger patients when I came back initially, was that when we were prioritizing and kind of divvying out our caseloads, the other two physios took on the younger patients for those first kind of couple of months, and we kind of switched around the age groups that we were seeing, and that really helped to kind of protect me and kind of cocoon me a little bit in those first few months, and then kind of slowly started picking up those referrals a little bit again. So I think if you have colleagues to lean on, like make sure you are sharing how you're feeling and being open about if there's particularly challenging situations that you feel you're just not quite ready to approach just yet, and making sure that you are leaning on those team members, and getting them to help you out where you can.
Thank you, Rachel. And I think you mentioned something really important there is about being open and having those conversations. And I hope we've in some way made a first step of that today in having this conversation. And as I said, potentially there is more to speak about with this topic. Because of the time, we will end the session now, but you are all hopefully part of our wider network. And for those of you who are not, we would invite you and encourage you to join the SIOP Rehabilitation Physical Medicine Network and Working Group. And definitely this is a subject that we could look at taking forward. So thank you again. If anybody has any further questions, then you're very welcome to ask those within our group. Very grateful to our 4 participants today. Thank you so much for sharing and being so open about your journeys. Thank you to everybody who has attended. A final reminder that this recording will be available on the SIOP YouTube channel, and it'll be open for everybody to view. Thank you all, and enjoy the rest of your day and afternoon. Thank you.
Thank you. Bye-bye.
Catherine, thank you so much. I think you can stop the recording now.